Hello, my name is Dorothy McFadden. I'm one of the registered dietitians at the St. Luke's Weight Management Center. Today we're going to talk about weight loss surgery and hair loss. To understand about the hair loss or hair shedding that occurs after weight loss surgery, you need to learn a couple things about the stages of hair growth. Anagen. Think of anagen active. That's the time of active hair growth. 90% of the hair on your head is in the anagen phase, and typically that active hair growth lasts 2 to 8 years. So your long hair that you have on your head has probably been on your head at least 4 years. Catagen, that's when the hair follicles start to shrink and get ready to be shed. That lasts 4 to 6 weeks. And then telogen, which is the actual shedding part of hair loss. 10% of your hair is in either the catagen or telogen phase, and it lasts 2 or 3 months. The average person will shed 50 to 100 strands per day normally, just a part of normal hair growth. Okay, causes of increased shedding. Premature shifting of the hair from the anagen to telogen phase is called telogen effluvium and is caused by multiple factors. It can be hormonal imbalances. Many times women who suffer from PCOS, polycystic ovarian syndrome, have hormonal abnormalities and may have hair thinning. Pregnancy. After you deliver a baby, because of the rapid shift in hormones, you may see more hair loss. Thyroid disorders, hypo and hyperactive thyroid can cause hair shedding. Autoimmune disorders can cause hair shedding. Extreme stress. Certain medications can cause you to lose hair. A high fever or very severe infection. Surgical or physical trauma. Anesthesia. Acute or chronic illness, and last but not least, nutritional deficiencies. So when you look at this list, a lot of people who go through weight loss surgery have many of these issues already, and then you add the stress of surgery on top of it. Okay, so telogen effluvium. Increase in hair shedding 3 to 5 months after surgery. No known treatment, but this is a temporary state. So I just want to emphasize here, there is nothing you can do to stop the hair shedding. You will have some hair shedding regardless of what you do after weight loss surgery. So what we're going to talk about today is how you can minimize it and promote hair regrowth, because you are going to have shedding and it's going to be alarming. Your hair will regrow if there's no other causes to the hair loss. Okay, so you're going to see 3 to 5 months out after surgery this increase in hair shedding, and it's going to be alarming because you're going to see more in your hairbrush. You're going to see it in your hand when you put it through your hair. You're going to see it on your pillow. You're going to see it in the drain after you have a shower or a bath. It's going to happen. Typically after weight loss surgery, telogen effluvium is caused by the stress of the surgery and the rapid weight loss. It increases after 6 months. Hair loss that increases after 6 months or lasts more than 12 months may be due to nutritional deficiencies. So what you're going to see is an increase in hair shedding 3 to 7 months out from surgery, and then you're going to kind of see it stabilize. It's going to start to drop off, and then you're going to start noticing between 9 and 10 months out little wisps of hair starting to grow in again, like around your scalp, okay? But if the hair loss continues to increase after 6 months and gets worse, or if it lasts more than 12 months, it could be due to nutritional deficiencies or some other cause. One of the most prominent nutritional issues that affects hair loss is iron. Iron deficiency anemia occurs in 20 to 50% of patients after weight loss surgery. It's very common in our young menstruating women. Symptoms include hair loss, anemia, fatigue, nail thinning. You also see nail peeling and impaired learning ability. The recommendation after weight loss surgery is 36 to 45 milligrams of elemental iron per day. So if you're taking 2 adult multivitamins that contain iron, typically a multivitamin contains the RDA for iron, which is 18 milligrams. You take 2 of those a day, you're getting your 36 milligrams. But women who are still menstruating or those who have a history of anemia, the goal is 50 to 100 milligrams of elemental iron per day. Ferrous fumarate is best absorbed after weight loss surgery and should include vitamin C. The type of iron that's in an iron supplement is called non-heme iron. It means it doesn't come from an animal source. So when you combine that with vitamin C, you absorb more of it. Some of the products on the market that we refer to, Biotin C, that is ferrous fumarate with C. Ferrets has a chewable and a capsule of ferrous fumarate iron, but you still would have to buy additional vitamin C to take with it. It's very important to have your blood work monitored. Iron deficiency can occur pretty rapidly after surgery if you're not keeping up with your iron supplements. And in women, ferritin levels below 40 can be associated with hair loss. We frequently have young women with ferritin levels below 10, so you can see where that can be an issue. Protein. You need protein to grow hair. Right after weight loss surgery, you're eating a very small amount of calories and you're struggling to get enough protein in. And what your body is prioritizing is your vital organs. You have to keep your heart healthy, your liver, your lungs, your kidneys. So it's prioritizing all those vital organs. Hair is not essential. We may think it's essential, but your body doesn't think it's essential. So it's not giving protein over for hair growth. The recommended intake after weight loss surgery is 60 to 80 grams per day, and we recommend that you choose a product that contains all the essential amino acids. Protein is made up of building blocks. There's the non-essential and the essential amino acids. An essential amino acid means your body can't make that particular amino acid. It has to get it from your diet. And when you're eating tiny amounts of food, it's really hard to get all those essential amino acids. If you take a protein supplement that doesn't have all those essential amino acids, your body will continue to break down your muscle to get those essential amino acids for your vital organs. Okay, so that's why we recommend certain types of protein supplements after weight loss surgery. L-lysine is one of those essential amino acids. It improves the uptake of iron, thus improving iron stores, which improves hair health. So it's important that you make sure you have a protein supplement that has all those essential amino acids. You can call companies, you can go on their website, or a lot of times it'll have it on the back, the PDCAA score. And if it's 100, then you know you're getting all those essential amino acids. So L-lysine is found in meat, fish, and eggs, which are a lot of the foods you're focused on after weight loss surgery. And if you aren't getting all the essential amino acids, if you supplement with 1.5 to 2 grams per day of L-lysine, with your iron supplements, it should improve hair health. Biotin. Biotin is a water-soluble B vitamin that plays a role in cell growth, fatty acid and amino acid production, and metabolism of carbohydrate, fats, and amino acids. It's often recommended for nail, hair, and skin health. There is no scientific articles to support or refute this claim. Many anecdotal reports suggest biotin makes a difference in hair regrowth. It's not going to prevent the hair from falling out, but a lot of anecdotal reports suggest that it helps hair come back faster. It's non-toxic. It's a water-soluble vitamin, so your body just urinates out what you don't need. We recommend an upper limit of 5,000 micrograms per day of the biotin. Anything above that doesn't really seem to make a difference in promoting hair regrowth. Essential fatty acids are also important for hair growth and hair health. When you're only eating a tiny amount of food, you don't always get all those essential fatty acids. And just like with essential amino acids, essential fatty acids cannot be made by your body. Deficiencies in essential fatty acids can lead to dry, brittle hair and a lot more breakage, your hair breaking off as you brush it. It also can cause a loss of texture, and your hair can look dull. It's not shiny like healthy hair. Flaxseed oil is a source of alpha-linoleic acid, which is this essential fatty acid. You can use it as an oil and add 1 to 2 tablespoons to your food, or your cereal, or your oatmeal, or you can just take 1 to 2 capsules per day, tiny little gel cap of 1,000 to 2,000 milligrams per day, until you're eating enough food to get all your essential fatty acids. So in conclusion, hair shedding or thinning is inevitable after weight loss surgery, but it is temporary. Temporary. It can be very distressing and alarming when it's happening, but it won't be ongoing. You will see improvement. So for healthy hair, make sure you take your vitamins and minerals as recommended. Take a protein supplement that has all the essential amino acids, and obtain your blood work as ordered by your doctor so we can assess you for nutritional deficiencies and make recommendations to treat those deficiencies. Thank you.